Our children are the nation's future, and we all have a role to play in ensuring that they are given the best chance possible to succeed. Jessie, Ripoll was the location for the 2014 staging of the Eyelite Optical Child's Month Health Fair. Over 2,000 children, guardians and teachers from 27 schools within the corporate area were entertained by several organizations throughout the day.
As Minister of Health, I wholeheartedly endorse this health fair. I want to congratulate the Managing Director for his vision, that's no pun, of having these fairs going across the country.
Well, the Monday Troop have been invited to this Eyelite Optical Fair, trying to show a lighter side to policing. Showing person that we are not all about, operations, but there's a light side to us that we, do community policing and outreach programs like these.
Let me first of all congratulate and commend Mr. Trevor Myers from Eyelite Optical, who is the conceptualizer and the main organizer of this event. And I want to say a big thank you to him for pulling together what is a tremendous and a massive ceremony prize-giving event and also a health fair. Let me also thank the many private sector and public sector institutions who have collaborated here today to make today possible.
Schools also participated in several sports competitions. Although it was Child's Month, this health fair was not all about the children. Eyelite Optical and Digital awarded over 125 teachers from participating schools for their service to the education system. Children that were previously identified with critical vision problems were issued their prescription glasses.
This is kind of the culmination of a series of screenings and education in schools. We're targeting an awareness of vision care among the children and the staff as well of the schools are being trained to recognize vision problems and to refer to the relevant healthcare authorities, particularly optometrists and ophthalmologists. As well, we're sort of pairing all of this activity with celebrating excellence, both among teachers and students alike. So we're awarding students for various levels of achievement, including the GSAT. If a child suddenly underperforms or if a child seems disinterested in class, oftentimes it's as a result of problems with the vision that the child may not be able to express, and so they act out, and the teachers are rather than coming down on the child to say, well, you're not paying attention, you're slow or so on, they could actually have some sensitivity towards the issue and possibly seek investigations to be done in the line of vision care. And certainly vision screening would come clearly before other modes of investigation, such as investigating a child for as a slow learner, for example, or referring to like the microcare or any other institution for that kind of thing. So vision comes first, and then of course there's the hearing tests and so on before you get to special education needs. We're bent on ensuring that every child who needs one receives a pair of glasses, if that's the answer. And so sponsors such as Digicel, Scotiabank, Juicy Patties and so on, they have all come on board to make sure that this happens for the children. So over the last 5 years, many sponsors have come on board to provide frames for these children, and we also partner with some of our labs to provide whether free or low cost lenses so that the children do receive vision care correction. For those kids who need surgical intervention, I myself ensure that this is done, sometimes through sponsorship, sometimes we shoulder it ourselves. And Jamaica Outreach Project, which is an initiative from Florida, out of Florida, Dr. Jeff Zim to be exact, helps us with our keratoconus cases, which are cases where the kids are born with abnormally shaped corneas. And some of these kids have gone on to have corneal grafts done. So it's a network and a partnership activity. Mr. Trevor Myers, who is the managing director of Eyelite, bodily goes into the schools and train staff, particularly the guidance counselors, and he also sits with the kids and does vision assessment. So he takes his remote control vision chart, and he actually goes through the painstaking process of doing visual acuities and referring to us at Eyelite Optical, where our optometrist and myself go through and examine the kids further to make the corrections. So this is an ongoing thing right throughout the term, right throughout the school year. And as I said, the health fairs are just usually a culmination of all of this. So for example, 16 kids will receive glasses that have been sponsored by our sponsors today. And this is as a result of tests that have been conducted throughout the year.
A number of healthcare professionals were on hand to provide free vision, dental, medical and hearing screenings to hundreds of attendees.
Well, they have those who have asthma. As I said, there's one child that had diabetes that had a little bit of an issue today, but we sorted that out. For the most part, the children are healthy. Some have their children with, there was 2 children with epilepsy or seizure disorder. Other than that, everybody was pretty normal, right? Which is what we want. We want persons who are in good health. Around school time when you do medicals, most of the children are usually normal, but you'll have those who will have their issues, the obesity, some with some elevated pressures, people with diabetes, and then you have those who have the infectious diseases like skin infections and scalp rashes and tonsillitis, those kind of things, yeah. The first thing is that you have to kind of take an overall look at what's going on from the home, from the school, with regards to making sure, first of all, what kind of nutritional intake they're getting with regards to foods. And not only that, because some children have obesity because of biochemical issues. So you have to take a more wholesome approach with regards to investigating the child for checking for any problems with their thyroid or anything like diabetes, those kind of things that can predispose to changes in weight. So you check for the medical things first to make sure that you don't just say, okay, they're just eating too much, because not everybody that's the problem. And then afterwards, now you say, okay, let's look at the diet, let's get into the nitty-gritty of it. What are you eating at home? how often are you eating, how much calories you're taking in, and then we get into it and try and make some alterations. And also the physical activity. We had one today that she wasn't doing anything at school, and she's, her body mass index, which is supposed to be between 18.5 and 20, hers was 35. So 18.5 and 25, sorry, and hers was 35. So it was way above the normal for her size. So we had to kind of do some counseling in regards to that and what she needs to do and speak to her teacher, because her teacher was here and not the parents. And so the teacher will have to be the one who will have to relay the information to the parents to see how we can make the alterations to make sure that she comes down to a healthy weight. Yeah. Well, the first thing is that the parent has to make sure that the child is taking in the proper nutritional content and the right amount of calories. So it's going to be the parent's responsibility, first of all, to ensure that at home they're eating right, eating good meals, proper meals, right time, and making sure that they're not taking in too much calories. And even if for children that are underweight, that they're taking in enough calories. And then they also have to ensure that going to school, whatever they're eating at school, they have to go and find out what is the child eating at school, what are they feeding them at the canteen, what is the teacher telling them to eat. Or they have to pack the lunches to make sure that the children get the right things. And then after that, now the parents have to ensure the child is getting physical activity. I spoke today about these schools that are coming up that have nowhere for the children to run or anything. I mean, a lot of private schools, which is, you need schools, but you need places that children can run and exercise, stretch their legs. And if you don't have that, the children are going to be sitting down. It's not all about the books, right? They have to get physical activity in order to stimulate their minds and make sure that their bodies maintain a healthy structure and healthy weight. Yeah.
This day would not have been possible without the assistance of the sponsors. We thank you all for your invaluable contribution and invite more of corporate Jamaica to join us in providing free health and vision screenings to those in need.
Today we have combined the best of both worlds. We're thanking the teachers who have given us over 25 years of service. And we are also doing a fantastic health fair for the community and the surroundings, and also the students here at Jessie, Ripoll, Clancarty. All the students in Kingston are invited, but today especially we want to have a top class event here at Jessie Ripoll Primary.
Scotia Insurance is here because we support the Eyelite Health Fair. We have been associated with it for a number of years in several communities across Jamaica. We support the thrust that he's making to provide vision care, hearing tests, and other medical screenings for the students. And we are all about wellness, Scotia Insurance, and so we support any initiative that is going to keep our young children healthy.
Yes, the reading competition, that was excellent. It's the first of its kind that I have seen, and I want to say kudos to all the children who participated in it. There are about 16 schools. Of course, Jessie participated too. It shows collaboration because we are able to host other schools. It exposes most of our partners, Juicy, Digicel, because we have an enrichment room and a resource room, all complements of Digicel. So I think it's a win-win way all around. Mr. Myers cannot leave us because he has been excellent to the school, taking care of my children, ensuring that the parents are educated about eye care, and ensure that the children themselves, and before GSAT he does an excellent presentation with them. And I know they appreciate that.
Good evening, everyone. This is the first time coming to this health fair. And this health fair is a very good and interesting. I don't know how long it's going on, but it's the first time coming to this one, and I enjoy it to the max.
We had dancing, playing, and we had drinks and samples and things for the kids, and lots of fun happened. And I really liked it because this was the best day I ever had.
The next Eyelite Optical Health Fair will be held on September 12th at Lennon High School in Clarendon. If you would like to contribute to the development of our nation's children, contact Trevor Mars at 383-9101 or email eyelitehealthfair@gmail.com. Better vision and health for our nation's children today will result in a brighter and healthier nation for tomorrow.